It didn't have to be like this. The worst days of the pandemic, more patients and more deaths arriving after vaccines became available.
We've been shouting from the rooftops for a long time now how bad this is and what this can do. And to watch it despite your warnings and your pleadings to just come through and take life like it does, that's hard.
In state after state, doctors and nurses are stretched to the breaking point. Some have no beds left to offer. Others have run out of nurses to staff them.
It's estimated that there were an additional 300,000 hospitalizations in the U.S. this summer that were totally preventable if more people had been vaccinated.
Facing the overwhelming surge, hospitals in states like Idaho are prepared to ration care, using crisis standards to decide who gets treatment. Even non-COVID patients may find there are no beds available if they need them.
We've heard stories about heart attack patients from Texas being flown eventually to Sacramento, California to get care.
More Americans have now died from COVID than the 1918 flu pandemic. 679,000 marked at this haunting memorial in Washington. The U.S. has become a cautionary tale.
This is an all-hands-on-deck crisis,
but is trying to serve as a global example. During a vaccine summit with Prime Minister Justin Trudeau and other leaders, President Joe Biden announced a plan to ship 1.1 billion doses to low-income countries that are desperate for the vaccines so many Americans seem to take for granted.
For every one shot we've administered to date in America, we have now committed to do 3 shots to the rest of the world.
At the same time, the U.S. is weighing whether to give more doses to Americans. On Thursday, the CDC will decide on booster shots, potentially offering a 3rd dose at a time when many are still rejecting their first. Donna?
Jackson Proskow in Washington, thank you.